Hey everyone, welcome to this explainer. Today, we're tracking a completely invisible, yet absolutely fascinating biological threat. We're going to be digging into the latest World Health Organization data on Hantavirus. We'll be unmasking exactly how it operates, where it hides out, and how it occasionally breaks out of the wild and into our modern human world.
Okay, let's dive into this. Seriously, what actually happens when a rodent-borne virus somehow boards a cruise ship? Well, back in May of 2026, the WHO issued a news release about a sudden hantavirus cluster directly linked to cruise ship travel. I know, it sounds totally unexpected, but it perfectly highlights how easily an ancient animal-borne virus can crash right into our modern, super-connected, globalized world.
To really wrap our heads around this threat, we're going to follow a quick roadmap. First, we'll ask, what is hantavirus? Then, a tale of two diseases. Third, how the virus spreads. Fourth, spotting the symptoms. And finally, number 5, prevention and treatment. By the end of this, you'll know the mechanics of the virus and, more importantly, how to stay safe.
All right, Section 1. What exactly is hantavirus?
So hantaviruses are zoonotic viruses. They belong to a family called Hantaviridae. Now, what's genuinely fascinating here is the relationship between the virus and the host. These viruses are carried by specific types of rodents, causing a silent, long-term infection. The rodents are essentially silent reservoirs. They don't even get a sniffle. But when that virus occasionally makes the jump to a human host, our immune system overreacts drastically, triggering severe, sometimes life-threatening disease.
To put the global burden into perspective, think about this number, 10,000 to 100,000. That is the estimated number of human hantavirus infections worldwide every single year. It's not a small number. And WHO data shows that the vast majority of this burden actually falls across Asia and Europe, with regions like East Asia historically reporting thousands of cases annually.
And this brilliantly illustrates our next concept. Let's move to Section 2, a tale of two diseases.
You see, the virus doesn't just act the exact same way everywhere. There's this incredible geographic split. It's almost like a Jekyll and Hyde situation. If you're infected in the Americas, the disease typically presents as Hantavirus cardiopulmonary syndrome, or HCPS. This aggressively attacks your lungs and heart, causing fluid to rapidly accumulate. But if you're infected over in Europe or Asia, it generally presents as hemorrhagic fever with renal syndrome, or HFRS. Just like the name implies, it attacks the kidneys and blood vessels, leading to low blood pressure and kidney failure. It's literally the exact same viral family, but it creates entirely different battlegrounds inside the human body.
And this distinction becomes incredibly stark when we look at the severity in the data. Over in Asia and Europe, the fatality rate for HFRS ranges from less than 1% up to about 15%. But in the Americas, well, cases are much rarer. The US, for example, has historically reported fewer than 1,000 cases total. But the fatality rate is exceptionally lethal, reaching up to 50%. It is a massive public health concern precisely because, when it strikes here, it's incredibly dangerous.
So, how does this dangerous pathogen actually reach us? That brings us to Section 3, how the virus spreads.
Now, you might be thinking about rodent bites, right? Well, that can happen. It's pretty rare. The main pathway from rodent to human is actually through contact with contaminated rodent urine, droppings, or saliva. The environmental risks are what really catch people off guard. High-risk activities include farming, doing forestry work, or even just sleeping in a dwelling that has an infestation. But perhaps the most common everyday risk is simply cleaning a poorly ventilated enclosed space. Think back to our cruise ship example from earlier. If infected rodents have been hanging out in a confined area, like a ship's lower storage decks, that virus is literally just waiting there in their droppings.
Now, what's really interesting about this slide is the Andes exception. Generally speaking, you cannot catch hantavirus from another person. It's a dead-end street for the virus. But there is one rare, fascinating anomaly, the Andes virus. Found down in South America, the WHO notes this specific strain has actually documented limited human-to-human transmission. It typically only happens among really close, prolonged contacts, like family members living in the same house or intimate partners in Argentina and Chile, and it's usually only during the early phase of the illness. It's rare, but it's a crucial exception to the rule.
Knowing how it spreads naturally leads to what happens once it's actually inside you. Let's hit Section 4, spotting the symptoms.
Let's map out what an infection actually feels like over time. It's kind of deceptive. There's a delayed onset. The virus quietly incubates in your body for anywhere from 1 to 8 weeks. Then the early phase hits, and it mimics a really severe generalized flu. We're talking fever, headache, muscle aches, abdominal pain. But then comes the late phase.
This is where the virus unleashes its true severity, escalating super rapidly into severe respiratory shock for HGPS or kidney failure and internal bleeding if it's HFRS.
Because that early phase looks exactly like the flu or COVID-19 or dengue, doctors face a massive diagnostic challenge. Seriously, how do you spot it early? The crucial puzzle piece for an accurate diagnosis isn't just checking symptoms, it's getting the patient's history. Knowing if they've traveled or been exposed to rodents at work is absolutely essential. Once they suspect it, they confirm it via PCR or serological testing. And here's a wild detail. The blood samples drawn from these patients are a serious biohazard risk, requiring maximum biological containment for the lab testing.
All right, we've covered the threat and the symptoms. Let's empower you with some actionable steps. Section 5, Prevention and Treatment.
Let's be absolutely crystal clear on this fact. There is no licensed vaccine. There's no specific antiviral cure for hantavirus. Because we lack a cure, early supportive care is your only real defense. Survival, particularly for that highly lethal HCPS variant in the Americas, depends entirely on getting early access to intensive medical care. Doctors have to closely monitor and manage the severe respiratory, cardiac, and kidney complications just to keep the patient stable while their own body fights off the infection.
Since treatment is purely supportive, prevention is everything. Pay close attention to the WHO's safe cleaning protocols. Step 1, always air out enclosed spaces before you enter. Let the fresh air in. Step 2, dampen contaminated areas before you even think about touching them. And Step 3, the crucial point is this: never dry sweep or vacuum rodent droppings. Doing that violently kicks the viral particles right up into the air, creating an invisible infectious cloud that you then breathe directly into your lungs.
Beyond those specific cleanups, everyday prevention really just means keeping your home clean, storing food securely so you don't attract any unwanted fuzzy guests, and sealing up openings in your building. Now, if you work in a healthcare setting, you'll be glad to know transmission risk is thankfully very low. Standard precautions and good hand hygiene are usually enough, though obviously you need airborne precautions for specific aerosol-generating medical procedures. Basically, good hygiene and keeping rodents out are your absolute best shields.
We started this explainer by asking how a rodent virus ends up on a luxury cruise ship, and we've seen exactly how resilient and opportunistic this pathogen can be. So I'm going to leave you with this. As our world becomes increasingly connected, blurring the lines between remote forestry work, urban living, and global cruise travel, are your daily cleaning habits actually enough to protect against the invisible threats left behind by the natural world? Understanding the intersection of human and animal health is your very first step to staying safe. Thanks for learning with us today.